Hey guys, welcome to my YouTube channel. This is Jay Patel and I am a certified physician assistant here at MyFitMed. Here I cover multiple topics to improve your overall health and fitness, and the topics may include hormones, vitamins, weight loss, and overall lifestyle changes. The goal is not to treat you but to educate you to help you get in the best shape of your life. Enjoy the video. So today I'll talk about delayed ejaculation, some of the common causes and things you can do to overcome delayed ejaculation. So it is a form of male sexual dysfunction characterized by marked delay in ejaculation or inability to achieve ejaculation. This is one of the male sexual dysfunction that is not commonly discussed. A lot of the patients don't discuss this with their medical provider. There's two main categories of the causes of delayed ejaculation. One is physiological causes and the second is psychological causes. The physiological causes can be pelvic injury, prostate surgery, pelvic surgery, nerve injury, some of the medical conditions like multiple sclerosis, cardiovascular problem, diabetes, and some of the neurological problems. Psychological causes are anxiety, depression, relationship problem, performance anxiety, and poor body image. Some of the other things that can cause delayed ejaculation are long-term alcohol use, drug use, and certain medication. Hormone deficiency has also been linked to delayed ejaculation, specifically testosterone or low testosterone level. So the main treatment of delayed ejaculation is to treat the underlying cause. So if it's due to some medication that you want to address that or discuss with your provider so they can switch the medication. If it's related to certain medical condition, then you want to address the underlying medical condition that may be causing the delayed ejaculation. This is mainly for the physiological causes. Now for the psychological causes, the main treatment can be counseling. So psychological counseling can help improve the psychological symptoms, and it can also help you address the alcohol and drug use. So if you are suffering from delayed ejaculation, make sure you talk to your provider. Make sure you discuss your symptoms so your provider can address the underlying cause if it's related to physiological cause, or can refer you for a counseling to improve your psychological causes. You also want to make sure you get your hormones tested. Low testosterone can cause delayed ejaculation, and improving your testosterone level may improve the symptoms of delayed ejaculation. Thanks for watching. Hope you learned something about optimizing your overall health. Talk to your medical provider before starting any treatment. Let us know what other topics you want me to cover. Give us a thumbs up if you like the video and subscribe for more videos.